Greetings. I'm Harvey Q. Johnson of the Phi Beta Sigma Fraternity Incorporated, Los Angeles Alumni Chapter. The COVID-19 vaccine is here, and it's safe and it's effective. We encourage everyone to get vaccinated. California is offering the vaccine at no cost. Vaccinated individuals should keep wearing a mask, washing your hands, and watching your distance until the vaccine has been widely distributed. Remember, your actions continue to save lives. Wear a mask, wash your hands, keep your distance. And when it's your turn, get vaccinated. For the latest facts, visit www.covid19.ca.gov/vaccines.
Good evening to all our fraternity brothers, all our sorority sisters of Zeta Phi Beta, our family, friends, all the people out there watching. My name is Ryeal Matos. I am the Director of Social Action for the Phi Beta Sigma chapter of Phi Beta Sigma Fraternity Incorporated. Welcome to one of our social action town hall meetings. Tonight, we're going to focus the conversation around COVID-19 and vaccination. So I'm greatly excited for the program that we have for you tonight. So before we begin, I would like to bring forth Brother Gary Hogan's Western Region chaplain, as well as chapter president of Phi Beta Sigma chapter, to give an invocation and get us started. Brother Hogan's.
Thank you, Brother Matos. Let us pray. Heavenly Father, we thank you, O God, for this event tonight. We thank you for all the panelists who have given their time and are giving and sharing their knowledge and wisdom concerning COVID-19. We ask that every person that's watching this broadcast be blessed and informed by what they'll hear and receive. And we just thank you so much. Keep us, O God, during this time, healthy, whole, and above ground. And we thank you for this, and we ask it all in Jesus' name. Amen. Amen. So again, looking at my other hat of being the president of Phi Beta Sigma chapter, I do bring you greetings, and I thank you for being with us here tonight. And without further ado, I would like to introduce our first speaker for this evening. Our moderator is Dr. Anthony Samad, who's the executive director at the Dymally Institute on the campus of Cal State University, Dominguez Hills. He's been a longtime civil rights activist in the Los Angeles area and recognized nationally for that. In Phi Beta Sigma, he's received the highest honor that can be bestowed upon a member, being selected to be in the Distinguished Service Chapter. And he's been a member for over 40 plus years. I don't want to give his age away because he looks so young, but we were just excited to have him as a part of our chapter and a part of our organization. So I look forward to just turning it over to him as he moderates an informative evening. So, Dr. Samad.
Thank you, Brother Hogan's. Welcome, everybody. It's always a pleasure to sit with my brothers. You know, I did a quick clothes change. I got out of my Institute shirt, I am an anti-racist, to my Phi Beta shirt, because last time I came on without paraphernalia, I had to catch it. And so we'd like to ask all of our other panelists to be patient with us as we rib each other. I've been in the fraternity since 1976, so this is my 47th year, well, 45th year, going on 46th year. And I've been a member of Phi Beta Sigma chapter since 1981, so this is my 40th year in the chapter. And I think this is an important work. And I want to give everybody plenty enough time to present their presentations. But I've been asked to give a brief history on Black healthcare and the skepticism around vaccinations. First and foremost, America has a history of excluding African Americans from quality healthcare. When we look at the history of Africans in America, even before we were enslaved, oftentimes our medicine and our treatments that came out of our culture. And even once we were enslaved and once we were freed, Africans or people of African descent oftentimes distrusted traditional medicine remedies. They oftentimes went back to home remedies or cultural remedies. And many of us have parents and grandparents who believed in home remedies. The indigenous people used to, in fact, call modern medicine witch doctors and everything else because they didn't trust the process. When we move forward into the 19th and 20th centuries and public health care became, to some degree, a common practice, African Americans were excluded from it. And when we were included on an experimental basis. And to this day, many people have apprehensions around quality healthcare treatment. It wasn't until the 1970s when community clinics were funded in the post-civil rights movement. Really, the first immediate benefit that we as a community received after housing was public health and public health clinics. And this was to create access because historically African Americans could not afford hospitalization. They could not afford healthcare. But healthcare became a right in the 1970s where whether you could afford it or not, emergency treatment was afforded to everybody. And that is when we began to really understand some of the historical context around the, apprehension of going to the hospital, going to the doctors, seeing appropriate medical care, specialized care. Everybody, has kind of tried to gaslight this COVID vaccination. And the first thing they throw up, of course, is Tuskegee, in which, Tuskegee vaccinations were basically hidden from the patients. They were told they had bad blood. And it wasn't until the 1970s that they basically disclosed, the federal government just finally admitted that it was an experimental treatment to try to find a cure for syphilis. And a lot of the men who thought that they were receiving medications were actually receiving placebo to allow the disease to play out so they could see what were the effects of the disease. And then it's not just with respect to Black men. Some of the same practices have been carried out on Black women, where in the last 10 years, we've discovered, that women were being given hysterectomies when they didn't need hysterectomies. They were being given mastectomies when they didn't need mastectomies. And basically because they were high pay procedures, with insurance companies and with government-sponsored healthcare systems. Oftentimes, we were given treatments that we didn't deserve. And the same with respect to treatments around diabetes. A disproportionate number of Black people received amputations that didn't necessarily need amputations, but didn't receive proper diagnosis and proper treatment. So the skepticism is real. It's a trust factor. As we talk about different sections of the country and regional approaches, a study came out just last year that 40% of Mississippians still don't trust, government healthcare or any kind of healthcare. You have people who won't even go to the hospital in Mississippi. They'll drive to Memphis because in Mississippi, African Americans have long held the opinion that if you went into the hospital, you didn't come out. Okay. Many of you who come from this community remember when they used to call Martin Luther King Killer King, because while Martin Luther King Hospital developed a specialization for treating gunshots, oftentimes a lot of people died, as Ice Cube says, from a scratch, because of the delay in treatment or the misdiagnosis in those treatments. So let's talk about COVID and COVID vaccines. Certainly, African Americans have lived through periods in which we have had contagion or we have had large spread pandemic. And all of us received polio vaccines. It wasn't our choice. Our mother had to vaccine us before we could enroll in schools. And I think that that's where they're about to go on COVID. Before teachers can come back, before students can come back, they're going to have to be vaccinated. So what are the issues around the vaccination? Well, part of it is rooted in the politics of 2020 and the failure to disclose the contagion in a transparent way. And so COVID became political. And when COVID became political, you had a president that had low credibility. He wasn't a trusted voice in the medical community. Even the folk who he had surrounded himself with could not correct him when he made crazy assertions like, taking disinfectant to rid yourself of COVID, or, don't wear masks, and herd immunity, will eventually cause the contagion to go away. We found out that on both accounts, he was extremely wrong. And as a result of that, 480,000 Americans have died. And, that's almost twice as many that died, in the 1918 pandemic. What we see now is an attempt to find a cure. And in the last days, of the last administration, I don't even like to say his name. In the last days of the last administration, it almost became like they were going to find a cure before election. Again, COVID becoming political. And they were seeking essentially the people who were the frontline workers, who were poor, who were Black and brown, who could not afford to stay home, and they wanted to seek out those treatments for them. And so they would use analogies such as, well, Black people helped develop this vaccine, a Black woman helped develop this vaccine. And African Americans know that, every Black ain't a brother and every smile's not friendly. And we've seen disingenuousness within our race before, driven by the profit motive. And now that you have Big Pharma involved, that's another area of suspicion for African Americans historically, because pharmaceuticals have not always treated African Americans in a way that benefited them. When you see the continued decline in mortality within African American community, which is right now 13 years less than that of whites. Okay, and so we have to ask questions. And anytime African Americans ask questions, we are perceived to be hostile. Even Serena Williams, a couple of years ago, shared her experience, when she was trying to tell her doctor that she received a improper diagnosis. The doctor insisted that she didn't know what she was talking about, and she not changed doctors, she would have died. Everybody has had an experience like that, or near everybody has had an experience like that, where we have gone to the doctor and they have told us one thing and it didn't sound right to us. And so Black people have become quite proficient at asking for second opinions. Well, I want to get a second opinion and even a third opinion, because we don't know who to believe. Okay. So the conversation around the COVID vaccine has become politicized. It has become gaslighted. It has become dramatized, as if our community doesn't take it, then it's not going to go away. When we see people in the Southern California region not wearing masks. And I think that you can run those slides anytime you want to, brother, because I'm almost done. We need to be deliberate in our efforts to get more information. The community as we know it, they single out voices to bring, whether it's public policy, whether it's health practices, whether it's police protocols. We oftentimes, are bombarded with different opinions and different points of view. It's important that the trusted messengers, whether it be the fraternity, whether it be the Urban League, whether it be, Charles Drew, whether it be King Hospital, we have to begin to get as much information as we can before the vaccine and the deadlines for the vaccine are upon us. We even need to know information as it relates to adverse effects. We all know people who have reacted adversely to the vaccine and have taken the shot and passed away. Most recently, last week, one of our, stellar community institutions, Crenshaw Christian Center, lost its founder, who basically delayed his COVID treatment. Then he went in for COVID, then he took the shot, and he had a reaction, and he passed away. Okay. And so we really need to understand what the upsides are as well as the downsides. We need to understand how it affects our lives, our children's lives, how our employment situations are going to be dictated by whether or not we take the vaccine. Is it going to be a choice, or is it going to be mandated? Because the government is all up in this. And I'm sure that that many of our panelists today can share a view on that. So without further ado, I would like to introduce our first speaker. Now, some of y'all got these bios that are like 5 pages, and I'm not going to read 5 pages. But what I will do is I'll read 1 or 2, and then you guys can tell me anything else you want the public to know. So let's start with Dr. Ryeal Sims. Okay, they just sent me your bio, so let me pull it up. This is what is called a technical delay. All right. Dr. Ryeal Sims is a relationship scientist and a cognitive neuropsychologist, behavioralist, motivation speaker, and a leading authority on the neuroscience of relationships worldwide. A licensed and certified relationship coach, counselor, marriage facilitator, body language expert with the Relationship Coaching Institute and the Prepare and Rich program. Ryeal's passion is analyzing the neuroscience of love and dissecting why we do what we do from an ego, bio, psycho, social, spiritual point of view. Ryeal is also a member of the GGI network of neuroscience researchers and the resident relationship instructor at the Optimed Neuroscience Coaching and Training Institute, where he integrates the disciplines of cognitive neuropsychology, biology, anthropology, and body language to teach youth, adults, and corporations how to make wise and personal and professional relationship choices. Formerly the relationship expert for Stevie Wonder's radio station, KGLH, Ryeal has also hosted London's Love Talks and is a reoccurring relationship expert on the UK's Real Love show, Mara Gale radio show, Table for Five, Dates and Mates with Damana Hoffman, and Roll Out Live. Ryeal has shared his unique knowledge of neuroscience on Africa's Let's Talk About It, the Virgin Islands Real Talk with Narcisse and Company, and LA's Talk Live Planet Love Match and Ryeal Radio, and Carla and Ryeal and the Carla and Ryeal Show. So without further ado, I'd like to introduce to you all Dr. Ryeal Sims.
Thank you so much. Thank you.
You're welcome. Do you have a presentation coming up or something?
Do I have a presentation coming up?
Oh, you want me to introduce everybody, and then I thought everybody was going to talk. Okay, I'll introduce everybody. No
That's what I thought. I'm just gonna...
I'm reading the backroom notes. Okay, so let me go back to my pages. And I want to give proper salutation to a longtime friend of mine, and he's one of those who I got close to when we were pulling off the miracle of the 20th century, which was electing a Black president. A lot of people give me credit for bringing Barack Obama to Los Angeles in a public space, but he had been to Michael and Mattie Lawson's house several times when he was running for US Senate, and that's how I met him. And Charles Ogletree first mentioned his name to me, but Michael Lawson is an institution, and so I want to call him Ambassador Michael Lawson. Presently serves as the president and CEO of the Los Angeles Urban League, one of the oldest and most respected civil rights organizations in the United States, dedicated to providing economic empowerment, educational opportunities, and the guarantee of civil rights for underserved communities in the Los Angeles area. In September 2013, Ambassador Lawson was nominated by President Barack Obama to serve as United States Ambassador to the Council of the International Civil Aviation Organization, the ICAO, a UN specialized agency, a position that he held from 2014 to January 2017. The 36 members of the ICAO Council sets the standards and recommends practices and policies in support of the international civil aviation sector worldwide. Before becoming ambassador, he served on the board of the airport, Los Angeles Airport Commissioners, Board of Airport Commissioners for Los Angeles World Airports from 2005 through 2011. And he served as president of the BOAC from 2008 to 2011. During his tenure, the board was responsible for the overall management of the system of the airports under his control, including LAX, LA Ontario International Airport, and Van Nuys airports. From 1980 to 2011, he practiced law at the prestigious international law firm Skadden, Arps, Slate, Meagher, and Flom, LLP, in their New York and Los Angeles offices until his retirement in 2011. Skadden is one of the largest law firms in the world with 1,700 attorneys and 22 offices around the world. The firm specializes in mergers and acquisitions, litigation, and other practice areas. The M&A Journal named Skadden Law Firm of the Year in its April 2010 issue. Ambassador Lawson led the executive compensation and benefits group in the Los Angeles office. He worked in all facets of executive compensation and benefit matters. He received his Juris Doctorate from Harvard Law School in 1978 and his BA in political science and economics from Loyola Marymount in 1975. He is an admitted and continued to be a member in good standing of the following bar associations: New York, District of Columbia, and California. Okay, he got another page to his bio, but he does a lot of stuff, serves on a lot of boards, knows a lot of big people, okay? And so I'd like to present to you Ambassador Michael Lawson. Our next panelist is a person that I have known for 40 years, and he's been my brother for nearly that long. State Senator Steve Bradford brings a lifetime of experience to the California State Senate and over 2 decades of public service, first as a Gardena city councilman, then as a state assemblyman, and now as a state senator. Senator Bradford has proven himself to be a great citizen activist. He views himself as a public servant and not a politician. Public service was instilled in him by his parents, who taught him the value of giving back to the community. He made history when he became the first African-American elected to the Gardena City Council. He's currently the only African-American senator in the California State Senate also, and he's the newly appointed chair of the California Legislative Caucus, African-American Caucus. As a member of the Assembly, Senator Bradford had 38 bills signed into law. He is currently the chair of the Banking and Financial Institutions Committee in this legislative session. He authored 21 bills. In addition to the legislative accomplishments, Senator Bradford secured $11.3 million in the state budget for Compton Community College and helped secure $35 million grant to Watts Rising for affordable housing, green space, and local workforce development. His favorite community event is the Dymally International. I'm just playing, Steve. His favorite community event is the Gardena Jazz Festival, where he serves as the festival's founder and chair. Senator Bradford grew up in Gardena and earned a BA in political science at California State University, Dominguez Hills. I'd like to present to you Senator Steve Bradford. All right. This is where it gets hard. I think I got one more or two more. Oh, y'all ain't talking to me now, huh?
You got one more.
Okay.
Save the best for last.
That's absolutely right. You know, y'all ought to be ashamed of yourself just putting one woman on the panel. Y'all know this is gender equity space now. Black Girl Magic will punish you for stuff like this. So I have to find her bio. Okay. Dr. Sheila Young, okay. Her education and training. Now, this is what they gave me, so don't get mad at me, okay? All right. Education and training was from the David Geffen School of Medicine at UCLA. Currently, she is a professor at Charles Drew University in the College of Medicine. She manages the CDU mobile testing site in conjunction with Los Angeles County Fire Department. She has an extensive background in testing, research in the minority community, and with respect to vaccines and vaccinations. I'd like to introduce to you Dr. Sheila Young. All right, everybody got their propers. Dr. Young, feel free, when your time comes, to correct anything or add anything that may not have been given to me. So now what I intend to do is kind of go in a circle, so Dr. Sims, you'll go first, Senator Bradford second, Dr. Young third, and Ambassador Lawson fourth. And then we will basically start the conversation. I'll give each of you a minute or two to open up and tell me why you're on this panel and why this issue is important to you. All right, Dr. Sims, you'll have to unmute.
Yeah, I think it's really important to me because I really wanted to bring to one's attention that I don't really hear much, and that is stress and how we could avoid, just by merely avoiding the stress and the fear that we have of the COVID-19. So it meant a lot for me to really want to talk more about, just what is stress and how we could actually minimize the stress of fear. Although stress is a good thing, but it's also, if we have stress too long, it becomes a bad thing. And what does stress do to us when we're totally stressed out? It actually weakens our immune system. So some of us actually can catch the virus just by how weak our immune system is. And I think that that's so important to understand, that the immune defense of our body weakens when we are constantly in stress. So that's one of the major reasons why I'm here. And two, what happens to our brains when we get COVID too as well, and how we can avoid that.
Okay, Senator Bradford, you want to tell us? I know that this has been high on your policy agenda, and you have been out there, helping constituents, not only fight COVID, but the residual effects of COVID, which is, the loss of income, housing difficulties, eviction difficulties. So help us understand, what the state's agenda is as it relates to these vaccines and how we overcome our fears on this.
Thank you, Dr. Shaman, and I want to thank Phi Beta Sigma, an organization that I've been a part of for close to 42 years, and all the work that you continue to do, Go Mob. It's critically important that we understand we as African Americans have always been at the back burner of being served and addressed as it relates to the need. And COVID-19 has only exposed the fissures that have existed in our community and further exacerbated the disparities that have existed in our communities as it relates to African Americans and people of color. It's critically important that we stay engaged. What we have done as a legislative body is try to stress the importance of making sure that these resources have been extended to all sectors of the community, especially Black and brown communities, which are being infected far more than any other segment of the community. We're being infected at a higher rate. We're dying at a higher rate than our white counterparts. And so it's critically important that we let our voices be heard, I should say. So I thank you for hosting this event tonight and allowing us to express some of the concerns. But we as African Americans need to be vigilant about making sure our voices are heard to clearly express, not only on a state, local, and the federal level, that in many ways, these resources are still not reaching us. As been clearly demonstrated, we have stood up plenty of these vaccination sites in our communities, but it's primarily our white brothers and sisters who are there, who are getting the vaccinations. And so that's the real issue I want to stress as a legislator, to make sure that people who look like us make sure that we are in line. We can't be afraid of this. This is not just a Tuskegee experiment that we all have read about and know all too well. This vaccination is real. It helps us. We need to make sure that we're aware of the benefits that this vaccination will provide to us. We need to make sure our elderly as well as the young folks are there and trust this vaccination. It's a sister, it's an African-American sister who helped come up with the vaccination that many of us are trying to receive right now. But my biggest concern is, as we've seen over the last couple months, is that we're not there. Even though they stand up these facilities in our communities, it's our white brothers and sisters we find ourselves in Inglewood on the vaccination site on Manchester, or at the Kedron Center on Avalon. So we need to not be afraid of this. This is, again, not just the Tuskegee experiment that happened, some 80 years ago. We need to trust this. We need to be willing to be vaccinated and encourage our family and our friends to do so as well. So that's my role as an elected official, to make sure that we trust that which is available to us right now and take advantage of it.
I'm gonna come back to you on that, because part of the concern that I've heard is folk are trying to panic us into it. We were the last tested, we're the last to get the vaccine, we're the most impacted, but nobody, wants to make a way for us. So, I'll come back to you on that. All right, Dr. Young, help us understand why we need to take this vaccine and why it's such a problem in our community to get access to treatment, testing, as well as the vaccine.
Well, I just want to say thank you again for having me on tonight, and just to be able to share with you. One of the things that I'm passionate about is making sure that we have the right information. There's so much misinformation from many different sources. And I think that one of the things that I like to do is really go down to the basics. What is the basic science of this vaccine? What is the basic science of COVID-19? And how does that affect us in general? And then what are the specific social, cultural, economic factors that determine our healthcare outcomes due to this virus? And not only this virus, other issues as well. And so those are some of the things that I want to bring forth. And there were a couple of things you mentioned earlier that I wanted to comment on. But first, I will say this, just in response to what a couple of folks have already said. And that is, I think it's important to not discount or invalidate individuals' feelings or their their true concerns. I think that in the medical profession, that is how we've lost the trust of patients, particularly patients of color. I've witnessed it. It's happened to me. It's happened to my family members. It's happened to me recently when my mother needed emergency surgery just a little over a month ago. And we were made to stand outside for over an hour with EMS after we told them that she had a small bowel obstruction due to adhesions, which were from ovarian cancer. And so I was dismissed completely. And so it happens to us no matter what our education levels are, what our income levels are. And this is what I want to fight against, and it's specifically racism in medicine. And it's at so many different levels. And it's going to take the work of us all in our respective fields to end and eradicate racism in medicine so that we will have an opportunity to live our full potential.
Well, you on my page now, because we spent all day talking about racism today. So then she threw it right up the middle of the plate for you, Ambassador. So what are we going to do about this racist system that basically decides to devalue us and discount what we feel in our own bodies and how we need to receive treatment, or those who want to receive treatment can't receive treatment, and those who have emergency access. And last year, they were talking about people were dying of COVID so fast, they was just talking about let old people die. And then they had a problem with me at that point. Okay, but we really need to understand, who's playing God here, and is there a process that we can trust that we will receive quality care around this COVID?
Thank you very much, Dr. Sumad. Dr. Young brought up a very important point, which is not fear of the medicine, it's the fear of the profession. And that fear of the profession is real. Infant and maternal mortality rates in the Black community, regardless of socioeconomic status, is way above any other group and has been for decades. And it is, so this is an issue that we've been talking about for a long time and trying to address it. And again, it's not the drugs that they do or do not give you as a mother waiting to give birth. It's not the science, it's the doctors themselves who treat us as less than. And the Urban League this is an issue that the Los Angeles Urban League is looking into, and Dr. Young's connection between our distrust of the COVID vaccine and the bridge between the distrust of the COVID-19 vaccination and really the distrust of the medical community is really what's happening here. So quite frankly, one of the things that we have been discussing internally and talking to people in the medical profession about the possibility of going to the insurance industries and saying, those of you who provide malpractice insurance to the medical profession, given how poorly you treat members of the African-American community and other people of color, all of those treatments should be treated as high risk sessions, and your failure to treat that person as high risk should in and of itself be malpractice. Your failure to recognize that the impact that your failure to do the utmost that you must do in order to provide service to this person should in and of itself be treated as malpractice. I say that only because what will happen as a person who, as you read my bio, most of my career has been dealing with the legal side of the equation. And what I'm proposing is we tell the medical profession that you tell the insurance companies that they need to, if they don't treat this as a high risk procedure, then the failed outcomes will fall on the insurance companies, and they need to tell the doctors that they insure that failure to treat these as high risk transactions puts them in danger. You charge them higher insurance rates, and I promise you that most of the medical industry will take note, because the one thing that this country believes in more so than Jesus Christ is the dollar. And if we can get them, we say you treat us poorly, money comes out of your pocket. And all we're asking you to do is treat us the way that we should be treated. Understand, if maternal and infant mortality rates are this high, regardless of socioeconomic status, you are doing something wrong. And that is what our community is reacting to. Yes, we've had Tuskegee. Yes, we've had situations where the role, looking at and I like what you said, Dr. Samad. I don't even want to use his name, but the previous occupant of the White House, not trusting him, understandable. But we must hold it's not the vaccine that we should be afraid of, because that the scientists have told us that this looks like it will work 90%, 70%, whatever percentage it is higher than 50%. Take this and you have a good chance of surviving this. It's not the vaccine that we should be holding to account. It's the profession itself. And right now we're conflating the two. So everybody should get the vaccine and sign up immediately, but we need to with a very sharp pen make it clear that it's not the drugs that you need to be concerned about, it's the people themselves. So if you dealing with a Black doctor, you should not have any concern. If you were, but what we want to do, what I want to see happen, what I want to be discussed openly is changing the way the medical profession, not the way, we need to change the way they're trained, because they're trained in a way that treats us as less than. They are trained to think that our skin is tougher. They're trained to think that we feel pain in a different way than anybody else. We will address that over time.
Right.
We will address that over time, but I'll finish this really quickly.
Right now has a site, or they tell people to go down there right now. I have people who are close to me, including an 85-year-old mother who's tried to get a shot 3 times. We're out of the vaccine, or you gotta go, you gotta come back at this time. It looks like a shell game or a runaround, and.
But there's 2 different issues, and I'll let you go right now. I'll let you go after I say this. There's sloppy rollout, and then there's people who don't want to get it. And I understand the sloppy rollout. Now I'll defer to our elected officials and administrators on that issue. My issue is, if it's available, I'm concerned about the people in my community who are saying, I'm not going to take it. I'm not going to get vaccinated because I don't trust. And I'm just saying that the trust should not be a mistrust of the vaccine. It's the mistrust of the medical system because it's not truly taking care of us the right way. And yes, a sloppy rollout exacerbates the problem, and I'm not suggesting that we give them a pass on that issue, but we need to hold the medical community, and I'll just be straight up, the white medical community accountable for their lack of attention to us. And that will change over the long run. That's part of what we have to do.
I agree. So, Dr. Sims.
I agree with you too with this. But
I got a question for you. What are some of the tools and resources you would recommend the community look into as a way to manage our stress and mental health around, you know, this whole care thing, because it is stressful. It is stressful. It impacts not only our immune systems, but our mental state. You know, I wouldn't be surprised, you know, in the next few weeks, if you don't hear about somebody going off at one of these sites because they done went down there one too many times and got to run around. You know, you know how people do, Steve. It's about to be a situation. So tell us how we would handle that.
Yeah, I think too, one of the best things that we should do is any kind of way that we can to get exercise, any kind of way that we can relax our brain is to get exercise, to get air, to still do things because we're isolated, because we're closed up. That part creates the majority of the stress too as well. And I think it's really important, even if it takes to just walk around in your backyard. I think that that's really important to help with our stress. I mean, there's so many other things that we could do as far as how do we relax. And I think it's so important to understand what we don't really understand what it's really doing to us. So we don't take that serious either, right? And so I really think that exercise is one of the key components to keeping us from becoming very stressful.
Senator, how do we get around this runaround? I know that you rolled out a few sites, you know, at Dominguez Hills, Englewood City Hall, Gardena, you know, and how do we ensure that the people that you would like to get the shot, as opposed to being turned away or told them, no, they're under 65, you gotta come back, your number ain't been called yet, that kind of stuff. Because process, I concur with Ambassador Lawson, process is a problem. You know, how they deal with us is a problem. Because, you know, my mom after the third time, she says, good Lord to take care of me. And I'm like, Mom, okay, we got to come back. No, I'm not coming back. You know, it's really a frustrating process. So how and then we go to our electeds, and our electeds open up more sites. And then again, the white folk beat us there. And then some kind of way, we catch the short end. So as a policymaker, you know, as a policy practitioner, how would you suggest we go about this?
He's on mute.
Your mic is off.
Dr. Samad, I wish I had a quick answer to that. What you described is the reality that we're all facing right now. As I kind of like challenge some of the folks on the governor's staff, it's not about standing up these facilities in minority communities. It's about making sure these minority communities are receiving the vaccine and receiving the treatment. And that's not happening right now. At Kendrick Center on Avalon, the majority of folks who are receiving the vaccination over the last 3 weeks have been people that do not look like us. They're white folks.
And they ain't never been down on 41st and Avalon.
I agree. And that's the most insulting part of this discussion. And I've raised this issue as an elected official. And they keep talking about standing up these facilities in minority communities, but it is not our communities who are in line to get these vaccinations. I had a facility in the heart of my district 3 weeks ago in Inglewood, on Manchester. And the majority of people who were there in on Inglewood, on Manchester, sitting in our lawn chairs were white individuals. And I don't begrudge any of those folks, but as I challenge the governor's staff, if we're going to set up these facilities, we need to make sure those folks who live in those communities are receiving the vaccine, are receiving the benefit. And that's part of the problem. It's not just our fear, and we can go back to the Tuskegee experiment and, you know, our distrust of the medical profession. But at the same time, it's part of our concern is that even when you're in our own backyard, we are still not the first peoples in line because you have not reached out to us. And that's what I've had, the discussion I've had with the governor's staff, with the various health institutions who are providing this vaccination, is making sure that we have true outreach in those communities who need it the most. And we're not doing that. We're failing miserably in letting those folks know right in their immediate backyard, in their neighborhoods, this is available, and they're the last to know about it. And so that's what I've been working on for the last couple of weeks since we've been back in session, to make sure that if you stand up a community vaccination site, be it in Carson, be it in Compton, be it in wherever community it is, that those people in that community are made aware of it first. And that's not happening.
Senator Bradford, if I could, thank you for all the work that you've been doing. I can let you know some of our experience from our testing site when it was on our campus. We went on foot and we went into the community and we addressed the fears and misconceptions that individuals had about getting tested. And so we're able to do this, but it really requires all of us to come together and the agencies to work together and talk together. One of the things that I've thrown out for months now is that we need to take this door to door. And we can do that with the proper resources, because we do have to pay our young people or the folks who we will train to provide vaccinations and also testing. We can do this. We have maps with the highest, that tell us where the highest rates of death, the highest rates of infection are. And we've been asking for resources, let us do this, but it's sort of, you know, gone in circles. So if you want to see our community get this vaccine and have them be the ones who receive it, you know, we've got to be able to not just set up the site and allocate the resources, but we've got to be able to have people on the ground who look like people who we want to get tested. That's the other issue. You know, one of the things that we do at our university is that we actually attract students who want to be there. We're a historically Black graduate institute. We're a Hispanic serving institution, Asian serving institution as well. And so when we and our students go out and on the streets, we know how to talk to people. We know how to address people's fears. And so this is what we need. However, the issue that always happens, you know, especially in communities of color, is that they want us all to volunteer every single inch of our life, right? And so you've got to put the resources there. And if you put the resources there, and I'm not saying you per se, I'm saying in general, if we put the resources there, then that will demonstrate that this is an important matter to you, that this is something that you really do want, and we can make it happen. And so there are ways to get this done. It can be done fairly simply. And really, it's really having a conversation. I do want to bring up one thing about the vaccine and about the mistrust. We also have to address the fact that there have been side effects, right, that people have seen. So how do we address that? Do we say, oh, well, it was only, one person or 36 people that this happened to out of, 31 million? But if that one person was part of your family, how does that affect you? Then to have a leader in the Black community, get sick after and then pass away after having received the vaccine, that's really scary for folks. And so I think that, again, we've got to be transparent and straightforward. Also know that these two vaccines, the Pfizer and Moderna, are not the only ones, right? There's other vaccines that'll be available. There's other vaccines that are available in other countries right now. So this is not the only two vaccines that we have. If people are so afraid because this is a new technology, a lot of scientists have acknowledged that as well, that this is a new technology. We don't have the 5-10-year studies that we normally have with vaccines.
Right.
So again, I think it's appropriate to have, a sense of reticence, yet at the same time, we have to assess the risks, right? What are the risks and benefits? And so, so I think that first, we just have to be real with people. And I think if we're real with people, then, this virus does not have to overcome us the way that it has.
Good point.
I want to do a quick follow-up on that, Dr. Young, because essentially that's what you see them saying now is we never said it was 100% effective. We said it was 95% or 90%. But I want to, while we have, our senator is a very influential person, and he's right there next to the governor. And I think the governor is proposing about $550 million for COVID, something like that. How do we ensure that people that have creative approaches to reaching underserved populations, how do they get some of that money? How are they assured? Because it's going to go to the big hospitals and the big health systems and those kinds of things.
I can tell you how many NIH grants that we've applied for. We've gotten some, but again, they're grants. And if you really want to see a difference, then we have to make the proper investment. One of the things that I talk about, that I've been talking about in different physician groups, is the fact that folks will use their research for underserved communities, receive their millions and millions of dollars, yet the benefits never come back. And the people will never see that. So then you really have to assess who are the people getting this, getting the funds, what's their track record been? And then really you could just honestly say, are they from this community? Are they afraid to get out of their car and walk down the street? If they are, then that they shouldn't necessarily have those millions and millions of dollars. If they're going to drive a different car to work, then, they drive in their own neighborhoods. That's not appropriate. And so again, I think that you've got to look at what's worked in the past. And I think that you've got to look at also, will organizations be honest with the money? I've worked internationally. I've worked in, Port-au-Prince, Haiti after the earthquake with hundreds of different international organizations. And of course, the big question is what happened to the billions of dollars that were, promised? When you go now, it's like so many things are not rebuilt. And so how do we ensure that the funds will actually not get lost in the bureaucracy, right? But that they'll get on the ground and they'll get to individuals. So how can we do that? We do that with partnering with organizations who've already been on the ground working. You know, we've worked with a number of community groups in South Los Angeles, with church groups as well. Of course, the Los Angeles Urban League. You know, there's so many groups that can help to facilitate, you know, doing what we need. But again, if it stays at a sort of a, how would you say, if it's a top-down approach, we won't get necessarily what we need. We need an on-the-ground, you know, boots on the ground approach. And if we do that, then we already know what we're capable of, right? We already know, like we already know. In Ambassador Lawson gave me a very nice speech one day, but we know that, you know, we can do great things. We know that there are different circumstances that affect people in certain ways, but we know at the end of the day that they're good people, and we know that people work really, really hard. And so I think that, again, we've really got to also put aside politics and sort of the, I guess I would call it, it's the territory of agencies. That's how I would probably say it best. It would be amazing if we could work together, if we can bring our expertise together, because oftentimes in healthcare, we work in silos, right?
Well,
physicians are not necessarily speaking with public health.
That's in academia, that's in everything.
Exactly. But we can't afford that right now.
Well,
we can't afford that right now.
You know, what I've taken away from this, you know, in the minutes we have left, is that our community is running up against process, is running up against politics, is running up against trust issues. But at the end of the day, we have to get that out there. Ambassador, how do we help the senator go to the governor and say, man, you need to just give this group this money and let them go door to door? How do we do something like that? I mean, because other communities are able to fashion, you know, approaches that work best. You know, one being the Latino community. They're able to, you know, almost design their programming, you know, put it in a language in which, you know, only their people understand, and then they make it happen. We can't just sit here, you know, and she's done an excellent job, you know, basically trying to convince, you know, 5 influencers that she needs to do this a different way. And what can y'all do to help her? Or did you just waste an hour of her life? That's the kind of passion that came out.
That's for all of us.
Yeah, I mean, the fact is that our communities have to hear from us, and it has to be more than just you know, a letter on our website. We have to engage the people who have the most influence in our communities, and quite frankly, that's our ministers. And beyond the ministers, it's the people within the community who don't have a title, but who are respected by the people in their community. We need to identify you know, that group and empower them. And you empower them by listening, quite frankly, and listening to the questions, listening to the issues, and speaking truthfully and with compassion. Part of the problem is that we haven't, you know, the churches haven't been you know, populated because of the pandemic. but when I, look at this Zoom meeting, we have the professionals, but we don't have the people who have the everyday connection with the members of the community.
Yeah, the trusted voices and the influence.
The ministers and so on and so forth. And we need to, there was a time not too long ago when any type of kind of community-wide decision-making that went on included all of them. And I think in part, when you compare us to the Latino community, they still have that communal communication network going. And I think we've stepped away from that. And I think we need to
yeah, we're gonna have to step back to it. Part of the problem is, and we've had this discussion across several forums that I've been a part of the last week or so, is we have to re-identify who the trusted voices are. We have to begin to identify intergenerational influencers, because young people ain't listening to us, and quite frankly, a lot of them listen to young people, and that's a problem. That's a problem. One of the last questions before I ask you guys just to make a final quick statement.
I wanted to make a quick.
Are they lobbying? Are they lobbying for that money, Steve? Because maybe we could put a group lobby together for Charles Drew, and we go up there with them to implore the governor to allow them to have a piece of that money for administering vaccinations to hard to reach population.
I wouldn't necessarily say they're lobbying for this money. I just think it's assume these organizations who have been here that are non-minority, non-African American, they're at the front of this line all the time. They're automatically considered the benefactors of these processes or these programs. So I think we need to be far more vocal. I don't necessarily think those organizations are lobbying. We're just not at the table. We're not, letting our voices be heard. I, as a legislature, as a member of the Legislative Black Caucus, we have clearly expressed to the governor and his staff the disparities that exist as it relates to not only testing, but vaccinations. Again, it's not enough to set up these facilities in our community, but it's more important to make sure that these facilities are serving those people who look like us in our communities, and they're not happening. That's not happening. Whether, like I say, Kedron, former senator, my predecessor, Rod Wright, who just got his second shot this week. When he got his first shot, he was blown away by the fact that he's in line. It's 300 something people in line, and he says, "Steve, it was less than 10 people that were African American on Avalon that look like him." And the same thing is happening, be it in Carson, be it in Inglewood at the Forum. And we got to make sure our communities are aware that the facilities are here, but that vaccination is available, and get our folks out, because we're missing it. It's some way that the outreach is far more effective in those communities and individuals that don't look like us. And that's what we need to do a better job at.
Yeah.
I think that go ahead, real quick.
Real fast though. I know I saw on the news a couple of times, and I don't know if it was in New York or New Jersey, where the African Americans that did want shots, it wasn't available. It was gone because the white people were coming into the Black neighborhoods and actually taking the shots there. So I also want to propose that we do. Okay, some African Americans may be afraid to get the shot, but what happens when somebody wants to really go get the shot? My line brother, Chad Williams, came up with an idea, and he said, hey, what if we treated it just like when we vote? in that community. You go to your area where you vote, and that's where you get your shot. Your name, if your name is not there, you go into your community instead of trying to go into another community and steal the vaccine from that community. Can that happen, Dr. Young and Senator Bradford?
I just know that they tried that in Texas, and I think one of the politicians or the mayor threatened to shut down that vaccination center. And so I think that, yes, we can. Perhaps, people have to generally sign up, but that necessarily doesn't work either, especially for, everyone's got their smartphone, right? But it doesn't mean that you can actually sign up for an appointment. And so we're looking at those issues as well. So we've really got to decrease the barriers. And then there really has to be, I would love to say something like, I wish we can get back to a point in our country, at least in certain communities, where, we actually have morals and care about other people. I know that money speaks loudest in this country right now, but we've got to morally shame people who jump the line and go to communities that they're not a part of. And it's sort of like you're exacerbating the mortality rates in this community by doing this. It's not all about you. And if you have the ability to be off of work and be on your chair, then that means that you have the ability to stay home and not be around people as well. The people who are on the front lines are primarily, or the essential workers are primarily people of color. Okay, and so we've really got to look at this, look at who's at highest risk, right? And those are the people who need to be prioritized. This was the same issue that we brought forth with testing. And it's the same issue that when we're through COVID, these are going to be the same issues with so many other medical conditions and diseases that we already see. So again, I want to thank you guys for having me on here. Know that this is one meeting, but this is a fight for the next 10, 15, 20 years that we've got to keep pushing forward. We are doing an amazing thing. We're opening up our a new medical program so that we can train physicians who care about their patients. And I'm looking forward to that. I'm so looking forward to that. And that is something that we need our Black community to support in this time. We're going to have our first class of 60 students in 2023. And 4 years later, we're going to have newly minted physicians who are dedicated to people who look like us and who will treat us with respect. Right now, what we had to do in medical school was go back and apologize to our elderly Black men and women who were spoken down to. And this was at the best hospitals in LA, okay? And apologize for the way that they were treated. That should never happen. So,
well, let me say,
oh, sorry, go ahead.
Everybody's time is valuable, but you have a group here. I got what you said. We can't. This is one meeting. We got to stop the one and dones. And I can truly say that now you have my attention, and we can try to put together a consortium of folk to listen to you, and include the senator, because we got to find another way to do it. You know, whether it's taking them to the senior citizen homes and just taking the medicine directly there, making it exclusive, or, you know, trying to create an application where the process doesn't frustrate people and doesn't allow people to jump the lines, because senior citizens and Black folk, quite frankly, they use public transportation. They can't sit out on the curb all night waiting to take the shot and then be told once they get up there that we just ran out, you know.
And it's not safe for them either. Let's just be clear about that. You know, we shouldn't be having our I don't even like to use the word senior citizen, but anyone who has a decreased function of their immune system should not be sitting outside to get a vaccine. And that's another reason why I'm really promoting folks.
I consider myself a young senior. My mother tells me all the time, you young seniors don't know shit. They know how to get everything free. But here's the thing. I'd like, you know, our fellow panelists to just give us a final comment on the scenario that Dr. Young has presented us, and talk about how we can move forward in trying to support her effort or support Charles Drew's effort or any community-based clinic, Kendrick, you know, and addressing this access issue, because this access issue is really, you know, we haven't even spent a whole lot of time talking about people who won't take the vaccine. We spent time talking about people who want to take the vaccine and can't get it. You know, that's the time. That's what we spent time talking about. And if anything, that's half the dilemma that to be resolved. Is how do we help the people who want to get it get access to it in a quicker way, that we know some circumvention is going on. So either one of you can start, but I bet you I get y'all off this call by 8:30. I bet that.
Yeah, I'll be real quick. And once again, just to how to maintain our stress is exercise and make sure that you get sleep. And if you could meditate, if you could get with an organization that can teach you mindfulness, you know, all of these things are great tools to help you relax from this pandemic and just the stress of this pandemic, just the fear, and also the fear of whether I should get the shot or not. You know, this will help. Absolutely. So I'm just going to be real quick on it.
Ambassador, Senator, anybody want to?
I'm sorry, Dr. Samad. I was preoccupied with something. I'm sorry. What did you ask me?
No, I just said, you know, give us a final statement as to how we could support Dr. Young's efforts to bring a collaborative effort to our community for people who want to take the vaccine, you know, and not have to deal with some of the access issues that they've been dealing with.
I think just what we're doing tonight, having continued dialogue to make sure that folks are aware that the vaccine is available in their communities, because again, I'm blown away at the number of folks who do not look like us that are in our communities. And I know for sure from talking to enough of my constituents and from enough people that look like me that we want this vaccine. But when you go into Inglewood, when you go into South LA, when you go into even Carson, where we just stood up a new facility at Dignity Health Facility, the majority of these people are from Palos Verdes, they're from Torrance, they're from Manhattan Beach. So we need to do a better job of making sure that people that look like us are aware of these facilities and this vaccination is available to them. So I think it's imperative that we do our part just to get the word out. And I think it speaks to some of the fissures that existed prior to COVID-19, the digital divide that exists in a lot of communities of color, the lack of the internet. I mean, even in urban areas, there's still pockets of people who still do not use a computer or do not have access to computer. So it's a culmination of things. And I think we just need to do a better job of getting the word out, because it's enough people that look like us who want this vaccination, and we need to do a better job of letting them know that these facilities exist and they're in their communities, and find a way to make sure that we make sure they're there to get the vaccination.
So do you have any final statements for us? Or you thoroughly discussed it.
Listen, we have to just continue to work with our brothers and sisters, and also work with the medical community. I mean, everything that Dr. Young spoke about is real and needs to be addressed on a major scale. The medical community, other than what you find, the angels that you find at Charles Drew, are not where they should be, and we need to hold them accountable. In the meantime, we need to wrap our arms around our brothers and sisters in our community and do everything we can to keep them alive. And that's what we're here to do.
All right, well, I'd like to thank all of you for being on this webinar this evening. Dr. Young, I can tell you that you will hear from a few of us, but particularly the Dymally Institute. That's what Steve funds us to do, is think, right? Work these things out, right? Right, Steve? And we're working on a couple of projects with the LA Urban League. So you gonna see us again, but you kind of laid out the case as to why we should be more active in examining this process. You know, the politics of it, you know, people's philosophy about vaccines and the trust issues they have with that. You know, there's not a lot we can do with that, but we can help you serve more people who want to get the vaccine. That we can do. And so I'll reach out to Ron Turner and have him put us together in another space where we can spend some extended time looking at the dollars, looking at the process, looking at who could be the recipients. Because part of what Steve said, Senator Bradford said, was that the people who were at the head of the line are the normal suspects. That's because they have the financial infrastructure. You know, when you're dealing with state funds, you know, they just don't give everybody money. So the same groups that have, you know, the fiduciary infrastructures get the money. And then the community organizations that have the ideas and may not have, you know, that same infrastructure in place, they get passed over. He can tell you, he put, $40 million in the state budget to study cannabis policy. And it went to all of the R1 research. We were the only one to get some money. And that's because we put together a plan, you know, for a regionalized study that was in our own backyard and, you know, with the state. And so we have the fiduciary infrastructure. And that's how we got selected. Everybody else was either a UC R1 university, you know, and they got like 6 or 7 grants each. And it's politics, but it is a process. And
we actually at the university, we have over 90 million in NIH funding. We've got our Urban Health Institute that helps run that. So we've got an Office of Sponsored Programs. And I really think it's not necessarily the management of the funds, but really, again, who's at the table? Who's at the table? And it's sort of, a lot of decisions are made based on certain connections as well. But, all I'll say is that when we work hard. And if you give us $1, of course, we turn it into 50. That's how hard we work.
All right. Well, with that, I'd like to thank you all for participating in this Phi Beta Sigma fraternity social avid COVID vaccination discussion.
Mr. Lawson, Dr. Young, thank you very much for joining us tonight. As the Director of Social Action for the Phi Beta Sigma chapter, Los Angeles alumni, these are the opportunities that we look forward to engaging in. So again, I'm with you. This event is all nice and everything, but it's just a start. And so you definitely have our support, and we definitely want to engage more to help folks in the Los Angeles area, the communities that we serve, become better educated. So we'll be reaching out to you to continue the conversation, figure out how our chapter can support the efforts of the Urban League and what Drew has going on. Brother Dr. Samad, Honorable Brother Samad, I know all the accolades, that title, brother, you wear that so well. And so we really appreciate you just jumping on and making this happen. I know your time is precious, and we appreciate you making the efforts to be here and leading this discussion. Brother Senator Bradford, thank you very much for, again, I know you're super busy leading the state, but we appreciate you being here and letting us know what's going on. So thank you for that. And Brother Dr. Sims, as a new brother, as the youngest brother in the chapter, for you to come into it and just bring your energy and enthusiasm, you have really lived up to what you promised us to do. And so we're very thankful for you bringing that perspective as far as the mental health issue, which is also extremely important and is very much overlooked, but we got to keep that in the forefront. So with that, thank you very much, brothers. Dr. Young, y'all have a blessed evening. To everyone that joined us tonight, thank you very much. And we look forward to the next virtual town hall. Thank you.
All right. God bless you guys.
God bless you. Thank you.
Thank you. God bless you. Bye-bye.